COVID-19 is on the rise across the country, and right here in North Carolina, the latest health department data shows 3% of emergency room patients have COVID-like symptoms, and that is an increase from the week before. With guidelines changing recently, folks might be wondering if you do get COVID, how long you might need to stay home. WCNC Charlotte's Megan Bragg verifies for us tonight.
This chart from the North Carolina Department of Health and Human Services shows their COVID-19 wastewater monitoring. COVID-19 continued to rise in August, which is now at moderate activity. Here in Mecklenburg County, COVID-19 cases also continue to rise. So what are the new guidelines if you get the illness? Let's verify.
Our sources, the Centers for Disease Control and Prevention and NCDHHS. The first question, when should you stay home? The CDC recommends staying home if you have symptoms that include fever, chills, fatigue, cough, runny nose, and headache. Next, when can you go back to work? The CDC states you can go back to your normal activities when your symptoms are getting better overall and you have not had a fever in the last 24 hours. However, if you do go back to work, NCDHHS and the CDC says you need to take precautions for the next 5 days to stop the spread, like wearing a mask, washing your hands regularly, and physical distancing.
It's also best to check with your employer to see if they have different guidelines. And keep in mind, the CDC says you can still spread the virus even if you are feeling better. If you do develop a fever after you go back to normal activities, you should stay at home. With your Verify, I'm Megan Bragg.